Welcome guys, and I know you guys are on Facebook there, and it started snowing. I know this was a whole concept of, I was kind of expecting, but not this much, but it's cool, and we're here. So we do these wisdom from health, wisdom for teachings that you don't usually get, you know, on different areas outside of being with practitioners, holistic practitioners. I often say, you know, when you go into, when you go home, and even sometimes in social media, you don't get a commercial on health and wellness. You don't get a commercial on proper balanced body or proper alignment or proper nutrition or yoga. There isn't commercials. You get a lot bombardment sometimes of concepts of only the medical side, which is necessary, but there's a lot more to health than that. So that's why we do these classes. Today we have the honor to have Chris Crawford here today, and it's someone who I was very blessed to meet because the amount of knowledge that he has for not just the body, but an overall comprehensive awareness of what it really takes to express your full potential. I think he has all the tools necessary. He brought a lot of tools here today that I guess he's going to be using, which is really cool. So I'm very happy to be able to allow this to my patients and just the people who are subscribed to be able to experience and learn more. But what's important is to not just take in and learn, but really take action. You know, if there's something that you really tuned into and you said, you know what, I'm going to take action on that, then make sure to kind of give yourself permission to do that for yourself. Because that's really how change is made. So without further ado, let's go ahead and let's bring down Chris Crawford.
Hey.
All right, thanks for having me, Dr. Imaña. All right, so I'm Chris. I'm a Czech practitioner, Soma therapist, Soma trainer, and Aldol practitioner. And today I'm just going to talk about the pillars of optimal health. So we have movement, nutrition, hydration, we have sleep, thinking, and just reaching out for your goals and dreams. Okay? So you have the handouts that I gave you. We'll get to those a little later during the discussion. So you have one Primal Pattern Diet questionnaire, which is like one part of the check system that I do use, and then also the four doctor readiness assessment that we'll get to as well. Okay? So first thing I want to talk about is when a new client comes in to see me. Okay, so first thing I do, everyone comes in, fills out their forms, their questionnaires, and I just get to know them. They get to know me as well. They come in for an initial assessment. It'll be a movement assessment, a range of motion assessment, a spine assessment. So again, if you're going to see Dr. Imaña, you're most likely coming to see him because you have some sort of issue with the spine. Yes. More importantly, like the cervical spine, so the upper cervical spine or the neck region. Yeah. So that's part of what we assess. We also assess the abdominal wall, so abdominal wall functioning. As an Aldol practitioner, we use Aldol Postures to help create space along the spine. Okay, so that space that's created along the spine will help to let fluid flow into the spine to help hydrate the disc, which will help to heighten the spine. So we can use this one for example. So here you have your spine. Let's say this is an example of the lumbar spine, and today I'll have you do a movement for the lumbar spine that feels good for everyone. So this is an example of the spine. This is a segment, and in between you have your disc. Right, inside the disc you have the nucleus. All right, so let's say here's an example of someone that may have like a disc bulge. All right, so if I squeeze this guy,
That's
right
really
here.
cool.
Yeah, I like this one. Squeeze this guy. And this is an example of what happens when there's like a slight herniation, and then there's actual bulging in the disc.
So that this is like a muscle? It's
not a muscle. So this is more like a nucleus. So like think of like this water, right? And then think of water and like this compression,
it's like
and
a
it has exactly. And it has the water has nowhere to go, so it has to spread outward, right? So now you also have nerves that are coming out of the spinal column. So as that happens,
this is a vertebra.
Yeah, exactly. This is a vertebrae.
This is the disc.
So these are the vertebrae, and you have the disc inside, so in the vertebral disc.
And the disc is made out of like what kind of material? It's like you just told me.
These?
The disc.
Oh, the disc. So you have the disc. So obviously you have the vertebrae. You have your bones, and then you have the disc itself, which is more so tissue or let's say watery substance.
It's
so
like
feel like
or something.
yeah, exactly.
It's like the same as the lungs. something like a wall, like it's flexible.
Yeah, it
Like
is
it's
flexible.
taking it
So
out.
exactly, yeah. So as these push on, it can move around a bit. But again, if there's any, say there's any damage to it, and there's too much compression along the spine, then you'll have that bulge that starts to happen, and that bulge will now push onto the nerve, and that nerve is what signals the pain response in the body. Not everyone's gonna feel pain right away. Some people do have bulges and they don't feel pain. I mean, you can ask Dr. Imaña, he's more of an expert on this than I am. But yes, so that's typically what will happen. So with the Aldol Postures, what we'll do is basically, say this is your bottom segment and this is your top segment. We fix the bottom segment, and the top segment we work on elongating, so pulling upward. That helps to create more space, so it's not pushing down. If there is some compression, we pull upward, create more space, allow water to hydrate. And in return, we're looking to just improve the health of the spine. So again, you'll still have to meet with your chiropractor, in this case, your NUCCA chiropractor, get your adjustments, everything like that. We're not gonna adjust the spine that way, but these will help to hold. If you do have an adjustment with Dr. Imaña, these will help to hold the adjustment a bit better. And then it'll also help to make those adjustments a bit better as well. It'll just get a better quality adjustment because he'll be able to manipulate the tissue a bit more. Okay.
So you are a chiropractor also?
No, not a chiropractor. I'm actually a soma therapist. Yeah, so I don't do like adjustments of the spine.
Yeah.
But I do pumping of the fascia, which will help in turn improve the quality of the spine. Okay, so improve the quality of the tissue. So the fascial tissue, the connective tissue in the body, which will then make it easier for the spine to move. So then again, like once you get your adjustment from Dr. Imaña, then it'll become a lot easier for your spine to hold that adjustment, and then a lot faster to get out of the pain if someone is in pain. Okay? And yeah, trust me, if you have any questions throughout, just ask me just as you're doing, okay?
Okay.
Because right now I'm here for you, so just ask me.
Yeah, it's not for me now, it's for everybody.
Yeah.
But I don't want to take up much of the time.
No, it's
fine.
fine. This is all based on your Q&A, so the more questions you have, the better it is. Okay,
Yeah.
so not a problem.
Okay, great.
Yeah.
I always thought that this was warm, was hard, but now I discover it's not.
The actual disc, well, yeah, see
That was my idea, very.
yeah, the vertebrae is gonna be hard. The disc will be a little softer than the vertebrae. The vertebrae is gonna be a bone, so it's gonna be softer in that case.
Logically.
But the actual disc, the actual disc can be compressed, which is where a lot of people will start having issues along the spine. So there's too much compression. People start losing their proper curvature. You may have like sliding of the vertebrae, which then allows more of like the disc to, let's say, protrude or out of the actual vertebrae. Then yes, then that's where you get the issues along the spine. Yeah.
Yeah. Wow.
And
That's why it hurts so much.
Yeah, I mean,
people
yeah, and some people have more pain than others. So some people you may have this much, right?
Yeah.
And it may not even be touching the nerve yet, but they may have pain. Or then some people may have this going on, and it's touching the nerve, and they may not feel it yet. So it also comes down to the person. Some people just have more sensitivity.
If you touch the nerve, that's the thing.
That typically will signal pain to the body, to the brain, which will then signal to the body, and then that's when you want to go and see a doctor. Exactly. So
maybe sometimes it's too late. When
it could be too late, but the goal is to hope that it's not too late and still work towards.
It's fixable.
Yeah, you always want to think that it's fixable, because if you think that it's too late, then there's most likely not going to be a chance that you're going to be able to recover, just because mentally you've already given up.
Okay.
Yeah.
So it's fixable, that's good.
Yeah, definitely. And again, you go see your doctor. They'll take your X-rays, they get you MRIs, and they can go over everything with you and let you know exactly what's going on with your spine, and then they can give you a process of how to rehabilitate it. Okay, so it could be an adjustment. Hopefully it's not surgery, right? But whatever the case is, there will be a way to help bring yourself back to normal, or at least get yourself out of pain. As long as, again, you get your adjustment and you do whatever homework you have that needs to be done at home. Okay?
Yes.
Yeah.
Good.
So again, so now we go on to say talking about hydration and say water, food. So if we have, let's say, inflammation in the body, it's going to cause stiffness along the fascia, so in the fascia. Okay, so now if we stick with the spine, there's ligaments, tendons all around the spine that help connect everything together, connect to the rest of the muscles in the body. Okay, so if there's a lot of tension or inflammation, which will cause tension in the ligaments, it's going to be a lot harder for it to move. It's going to be really stiff. Okay, so if we're not hydrating the body properly, if you're not drinking enough water, enough good quality water, then it's going to lead to, again, the stiffening, which will then lead to more compression, which will lead to more pressure, more, let's say, eventually pain, and more like the higher likelihood that you're gonna end up with some spinal issues. Okay, so you have lower back, thoracic spine, so that's the middle of the back. You have the cervical spine, that's the neck. Mostly what Dr. Imaña specializes in, correct? Yeah, so mostly the cervical spine. And I know he focuses on the entire spine as well. But the work he does with the cervical spine is like magic.
Scoliosis.
Yeah, scoliosis. And again, it's just different curves of the spine. Scoliosis, like with the Aldol postures or just taking care of your body, you can actually reverse your scoliosis if you follow like correct procedures. So again, go get your MRI, go see the doctor, find out, is it functional, is it structural? So like, are you born with it? Is it something that you just developed over time just due to like bad posture, moving patterns, just bad habits? Okay. There's a ton of details on scoliosis and like how to determine if someone has a structural or a functional scoliosis. So you just want to make sure that you know exactly what's going on in your body.
Yeah.
Get the proper help, and then do your homework at the same time. Okay.
Like a sort of therapy, like exercises.
A combination of everything, right? So you have your treatment, so you have therapy. Let's say you have exercises, you have stretches, you have mobilizations. You have your warm-up. So if I was going to give you an order, let's say you went to see your chiropractor, they did an adjustment. I actually have a few clients that go and see Dr. Imaña. So that they'll go see Dr. Imaña, they'll get their adjustment, they'll come to me. After they've already gotten the adjustment, now it's time to hold the adjustment. So now they want to focus on, okay, what I'll do first, I'll do like a little bit of soma therapy on them. That will help to, again, I was telling you with the inflammation, that that inflammation is causing the stiffening of the connective tissue. So now with the soma therapy, what we do is Osteo-Articular pumping of the fascia, so of the joints. And what that does is allows more fluid to flow just into the fascia. Fluid in this case, mostly water, we'll be talking about. We also have like cerebral spinal fluid, okay? So, yeah, go ahead.
No electrolytes, no sodium.
Like in the water? In the water?
Yeah, in the water.
Yeah, you want to have minerals in the water. So you can have water with electrolytes.
Yeah.
Yeah.
The electrolytes is the same as sodium, potassium?
Yeah, that's an example. That'll be an example of electrolytes.
Yeah.
That'll be an example. So like, the water I like to drink is Mountain Valley spring water. Pretty good. Fiji's pretty good. Fiji's pretty good. You want to look at the pH level, and you also want to look at the dissolved mineral content.
Yeah.
So I know Mountain Valley Spring has about 220 dissolved minerals, but then I also add some Himalayan salt, which just adds like just more minerals and to the water itself.
Yeah,
so it just brings better quality.
It's the thing that they clean the aluminum, the aluminum that causes Alzheimer. So the Fuji they have this thing, like actually.
Wait, so what was your specific question?
The Fuji.
Yeah, Fiji.
The Fuji, they have this property that they say they clear the aluminum. They have one metal. Fuji is very rich in some metal. I don't know the exact name now.
I don't know off the top of my head, I can't remember.
Maybe someone will talk about.
Yeah.
Next time.
Yeah, okay, definitely next time. I'll bring a couple of samples of water actually next time. We could talk about some hydration and just the different types of water and which ones are better for you. And again, everyone's body's a little different, so it comes down to you just trying different ones and seeing which ones fit best for you. Whichever one you can drink, whichever one is good for you to drink, it's probably the best one for you to have because you're actually going to drink it. If you have one that might be better quality, but you don't want to actually drink it, then it doesn't serve any purpose for you.
Right.
Okay, so the same thing with food, same thing with exercise. If you have like exercise program that you don't like and it's not fun for you, and you don't want to do it, you're most likely not going to do it, then you're not going to get any benefit. That's where it comes down to just like personalized programs, which is part of what I do as well. Just personalized exercise programs, make sure that the client can actually adhere to it. Whether it be time allotted, it could be an hour, it could be 30 minutes, it could be 15 minutes, depends on what the client can do realistically and consistently. Whatever they can do realistically and consistently, then that's what you want to focus on. You don't want to focus on just giving everyone the same routine because whether it be nutrition or let's say dieting or let's say exercise, you don't want to give someone the same routine because not everyone's going to adhere to the same thing, so you have to find out what works for each person. Yeah, and then again, not everyone's going to have the same amount of time.
And that's the name of your center?
Dekhana. Yeah, that's a business that I have. And friend Jose works with me as well.
No, good.
But I know you got to know him pretty well.
Good guy.
From the smoothie.
Yeah.
Yeah. Do you have another specific question or?
No, please go ahead. I
Okay.
think I have too much.
Yeah, sure. Okay, so we're talking about inflammation. We're talking about, again, hydration. So by drinking enough water, and then also us doing the soma therapy, which will now allow, we do the pumping of the osteo-articular joints, right? So we do the pumping of the joints in the body. That then helps to hydrate the fascia, which will then make everything a lot easier to move in the body. So all the joints in the body will be a lot easier to move. And then now if we take it directly to the spine, we have this segment, or show this one for example. So same model. This would just be part of, let's say, the lumbar spine. Yeah, so this would be more like the lower back region. So it's like color coded. Yeah. So you have like the middle back, you have the neck, you have the lumbar spine, the lower back, then you have your sacrum, and at the end you have your coccyx. Okay. So let's say, for example, someone has, let's say, a bulge, like I showed you here, some kind of this bulge going on, let's say at L2, right between L2 and L3. The goal is with the Aldol, and again, hydrating the body, making the fascia a little easier, a little more, let's say, lubricated, easier to move now. Now when you do your Aldol, you keep, this point is fixed. This is supposed to be your L3 segment. You take L2, you're gonna pull it up. Now, remember again, it's lubricated now, easier to move. So now this space becomes a lot bigger, allows water to get into that space to hydrate the disc, and again, make it healthier. So now by hydrating the disc, give it a little more height, okay? And by giving it a little more height, now